Chapter 3 of ICD-10-CM is for diseases of the blood and blood-forming organs and certain disorders involving the immune mechanism. As there are currently no official ICD-10 guidelines specific to this chapter, we will focus on clinical scenarios specific to the chapter, followed by a small quiz at the end of the presentation. For each coding example and quiz, you will need to pause the webinar and use your ICD-10-CM coding manual to code the scenario. Once you resume the webinar, we will go over the correct codes, the rationale behind them, as well as how to locate them in the ICD-10 manual. Keep in mind that there may be more than one way to find a code. We are aware that there is a great deal of information contained in this presentation. Therefore, at any time during the webinar, please feel free to pause and replay as needed. It is important that you have already completed the Introduction to ICD-10-CM webinar, as you will use the conventions and general guidelines discussed in the introduction to complete the coding scenarios. As you can see on this slide, the codes for this chapter start with the letter D, and if you remember from ICD-9, these codes all started with the number 2. However, in ICD-9, this chapter followed the endocrine chapter, and in ICD-10, this chapter precedes the endocrine chapter. The most commonly used diagnoses in this chapter are all the different types of anemia. It is very important that provider documentation is specific to the type of anemia the patient has, as opposed to simply documenting anemia. As I stated on the first slide, there are currently no guidelines specific to this chapter. However, there are important instructional notes throughout the chapter, such as lots of excludes one notes, meaning the two conditions listed can never be reported together. I want to talk a little bit about anemia, as it is very important to be as specific as possible in the code selection of anemia. The code for anemia unspecified should only be used when the type of anemia cannot be identified. If the documentation states secondary anemia, it should also state the cause of the anemia, such as due to blood loss. I also want to point out that there is a difference between anemia of chronic disease and chronic anemia. Anemia of chronic disease means the disease that is causing the anemia is chronic, as opposed to chronic anemia, where the anemia itself is chronic. For our first coding example, we have a 68-year-old man who presents to the emergency department, admitted with a diagnosis of sickle cell crisis with acute chest syndrome. How would you code this? Please pause the webinar to complete this example and then hit play to continue and learn the answer. Because we have so many combination codes in ICD-10, we have a single code for this patient, which is D57.01, hemoglobin SS disease with acute chest syndrome. To find this code, start in the alphabetic index under crisis. Sickle cell is indented below, then the word with, and then acute chest syndrome. This gives me code D57.01, which I then confirmed in the tabular. Let's try another example. This patient has congenital red cell aplastic anemia and returns to physician for follow-up. How would you code this? Please pause the webinar to complete this example and then hit play to continue and learn the answer. The answer is D61.01, constitutional red blood cell aplasia. This code was found by going to anemia in the alphabetic index. Indented under anemia, I located aplastic, then looked for red cell. Indented below red cell, I found congenital, which led me to D61.01, which I then confirmed in the tabular. Our final coding scenario for this chapter is a patient with periodic neutropenia, here for their annual visit with the hematologist. How would you code this? Please pause the webinar to complete this example and then hit play to continue and learn the answer. This visit would be coded as D70.4 for cyclic neutropenia. You would find this by going to neutropenia in the alphabetic index, looking for the word cyclic, which points to D70.4. Of course, you want to always confirm your codes in the tabular index. Now it's time for our quiz. Our first question is, if a patient has myelofibrosis, which is D75.81, due to a malignant neoplasm of the breast, which is category C50, which diagnosis should be sequenced first? Our second question, category D89 includes and excludes to note for transplant failure and rejection, which is category T86. Can a code from category T86 be coded along with a code from category D89? You can pause the webinar to write down your answers and then hit play to find out if you were correct. The answer to our first question is the malignant neoplasm of the breast. We know this because if you look up D75.81 for the myelofibrosis in the tabular index, the instructional note in red states, code first the underlying disorder, such as malignant neoplasm of breast. The answer to the second question is yes. If you remember from the introduction, excludes to means the excluded condition is not part of the condition it's excluded from, but the patient can have both conditions at the same time, meaning both can be coded. Remember, the United States will begin using ICD-10 on October 1st of 2015. After the October 1st compliance date, it will be very important to verify that claims are being received and to check remits for denials based on the ICD-10 conversion. This concludes Chapter 3 of ICD-10-CM, Blood and Blood-Forming Organs and Certain Disorders Involving the Immune Mechanism. Please feel free to check out our webinars on all 21 chapters of ICD-10-CM. If you need further assistance with ICD-10 training for physicians or staff, please visit the VantagePoint website at www.vantagepointconsult.com or call us at 203-288-6860. Thank you.